So thank you, Sue, and that was a great welcome. And my pleasure is now to say something about the working group, or actually the topic biomedicine, epigenetics, and the hygiene hypothesis. My name is Mechthild Groß. I'm actually a midwife, and we are running a master's program at Hanover Medical School, which is in Germany. I wanted to put it in a bit more broader frame, and I'm pretty aware of that because it's the first section. And many of you may know this particular framework, which you can see here. And you see that most of the women, they really need education, they need assessment, they need promotion of normal processes. And a fewer part of pregnant women, they may experience complications. And all this is embedded in organizations and values and philosophies, and has lots to do with how care providers are actually helping women, supporting women, and providing care. And this framework is certainly something which is going to be addressed also by other work groups in terms of their particular topics, but I thought I'd bring it up here in the beginning. And earlier in this year, in June, 3 days before the Normal Birth Conference started in Ann Arbor, a paper came out led by Holly Kennedy, and it's really taking up the issue of addressing further research question. And this paper is pretty much referring to the framework which I have just been showing you. And in Holly Kennedy and her group, they show a picture here and they say, okay, most of the women, they need really strengthening and empowerment, and so that they can benefit from the experience of becoming a mother. And a fewer group is this particular group, which is really experience major, also medical related difficulties, which needs closer monitoring and more consultations. And referring to this bigger part of the picture, the group came up with 3 research priorities. And they are optimizing physiological processes across the childbearing continuum, development and validation of outcome measures that capture short and longer term well-being, and an understanding of how effective models of care work, including skilled midwifery. You may ask now why I'm presenting this here, because I'm supposed to talk about biomedicine. So what has this all to do with our subject here? And we see, especially in this particular topic here, that the optimization of physiological processes is something which really should be picked up in more depth. So why biomedicine? And the question, or the answer to this is not only partly, but I think the key to this is that we need to understand mechanisms that underpin the effectiveness of already known models of care. We need to know short and longer term outcomes, this in respect to short and longer term outcomes. And we need to understanding the optimizing and disturbing aspects in the biological processes for healthy childbearing women. And last but not least, physiological processes during childbirth are confounded by procedures and interventions, and this needs to be addressed as well. And I really want to stress and want to make the point here that we know so much as results of randomized control trials. We know how they work. We are at the moment pretty much investigating to find the right outcomes in terms of the COMET group, the CROWN initiative, and also SIPCOS. But a randomized control trial always has the major task to find a cause. Find a really cause. You can say the outcome X happened because we did this and this intervention. But you are not studying mechanisms. And this is why we need biomedicine. Another point is epigenetics. And I'm pretty aware that some of you may not have had so much to do with this term until now. And I'm grateful to Sue, who actually offered me this slide. So Sue actually says here, why this picture is referring to that the same set of genes has different expressions over the course of life. And this may then result in the particular experience that during the early life, women and also neonates are experiencing a particular vulnerable and a period full of plasticity, it may also actually move into a gene silencing, so nothing is happening, although the genes are there, and this altogether may be inherited to the next generation. So this is something what we need to look more specifically after. And Sue was majorly part of this group and leading in this group of setting up the EPIC hypothesis, epigenetic impact of childbirth hypothesis. And the major idea or the major assumption is that the use of interventions during labor, such as synthetic oxytocin, antibiotics, C-sections, that they are able to influence epigenetic remodeling and microbiome environment. And this is then subsequently related to the health of mothers and their children. But there is already some knowledge about in this area. It's called the hygiene hypothesis, and as you can see in the reference in the bottom, it came out in the late 80s. Intrapartum and early neonatal interventions may affect the neonatal immune response system, and even this may occur transgenerationally. So the idea is, and what we know, that all the bacterial small little babies may experience when they are close to cows, like it happened, by the way, at Christmas, you know. Diversity contributes to the development of the immune system, and this has been called the hygiene hypothesis. But the gut microbiome, and now we are moving a little bit further to the so-called extended hygiene hypothesis, might be actually experience issues which are secondary then intervene, investigate, and affect the interpartum, the environment in the immune response with regard to mode of birth, pharmacological interventions, and environmental factors. And this is called the so-called extended hypothesis, a hygiene hypothesis with associations to long-term non-communicable diseases. And Sue has a slide which says the same, but probably even much easier and simpler. So as she's stating here, at birth and for the first weeks to months of life, the baby is seeded with microbes from the mother and from the environment, and they reside in the gut, in mucosal tissues, and it's the balance which is needed and which seems to be crucial for regulating immune responses and avoiding inflammation-driven diseases. And what we actually working on, what there's lots of knowledge around, that elective C-sections have very low bacterial richness and diversity at 4 months following birth. This is probably something you are pretty aware of. And I want to stay a little bit and take the mode of birth as an example before we move on further. So what we have here is that you see in the upper line a picture where a baby is born vaginally, and on the right-hand side where it's born by C-section. And if a baby has been born, it experiences maternal microbiota, physiological stressful birth. But if this is not happening, then on the other end, it may result in a dysbiosis in the gut, and then impaired, which has associations to the immune system and may result in an increased risk for childhood and adult disease. This is from a paper which came out in March this year, and it's probably very worth looking at it because it's really summarizing the state of the art in this area at the moment. So for the next couple of minutes, I'm going to talk a little bit about birth cohorts, because this is the area, it is actually designed which tries to address all these issues. But as I said previously, an RCT finds out if an intervention works, but not how it works. And now when we are moving on to the cohort studies, you should be aware of that, and cohort study is able to find out how an intervention works, but not if it works. We have very much reason to assume, to believe, that all these associations which are going to be detected by cohort studies, that they are close to being true, but as the design is not embedded in RCTs, we are always a little bit caught up by this limitation. If you want to know more about birth cohort studies, you may look at TICOS at the website, and if you go there, you find actually 77 listed cohorts from 21 countries. And one particular, I looked through the list again, and I found one study which is called "What Influences How Long Mothers Fully Breastfeed" from Norwegian. It's a couple of years old. Probably some of you know it, but I think this is a quite nice study which probably has something to look at and to learn from. My impression was that there is a newer website which is called Birth Cohorts.net, and Birth Cohorts.net is now more or less addressing the current and very recent issues which are going on in birth cohort research. And you may also see this if you look at the funders which are funding this site, Birth Cohorts. They are from several very and major cohort studies which are currently taking place in many countries. Here you see an overview of some of the study. Don't worry if your study is not on it, because it's difficult to catch up and to keep. And I want to pick out some particular studies. We have had the fortune and the luck to work very close together with Maria Carmen Collado in our group, and I see the group smiling, so thank you. Hello. And so you are very welcome to listen later to the session of Isaac Kuhn, who is going to present probably more about this particular birth cohort, which is set up in Spain and in the area of Valencia. And as Sue always stressed it, 1 minute. Okay, Sue, I'm hurrying up. We are collecting out of hospital births first, to say this here. Then we have the first French national birth cohort study. We have a German birth cohort study around the area where I live. And then what we have here and what's going to be presented also this morning is the Lifelines Next study testing the EPIC hypothesis. It's around William Peters, Ank de Jong, and another Dutch name which I find difficult to express, but the person is on the program at the first session this morning. And they are really collecting lots of samples from the neonates, and I think this is really addressing and showing that at the moment there is lots of discussion about finding the right sampling and the right techniques in analyzing the samplings. Last but not least, we have heard now a little bit about microbiomes, we have heard a little bit about epigenetics, but less about stress and about the neurohormonal axis. And I know that we are listening and hearing a lot of the hypothalamic hypophysis axis, and I want to conclude with this very final slide again from Sue, that the immune system operating via the central nervous and the neuroendocrine system may act as a transducer between experience and disease. So lots of hormones will be around here in the next couple of days. So I'm very much looking forward to this experience. Thank you.